When you're feeling short of breath or wheezing, it's important to make sure proper technique with the rescue inhaler is used so adequate medication is delivered. Rescue inhalers are used for the treatment and prevention of wheezing and shortness of breath in adults and children 4 years of age and older. First, remove the cap and make sure to shake the inhaler well. Breathe out through your mouth, making sure to push out as much air as you can. Push the top of the canister down while you breathe in deeply and slowly through your mouth. Hold your breath for about 10 seconds. If your provider wants you to use more sprays, wait 1 minute and then shake the inhaler again before each use. Put the cap back on the mouthpiece after every use. Spacer devices, when used properly, substantially improve the delivery of the medication. They are especially useful in children who might have a hard time inhaling at the appropriate time as the medication is being delivered. It's important to know that you can't tell your inhaler is empty just by shaking it. Some inhalers now have dose counters on the back, so you're aware if there's still medication left. If there's no counter, keep a journal of the number of sprays. If you are using it often and not keeping track, refill it every month so you know you have medication available.